Hi everyone! A blessed day to all. I'm always praying for your safety, protection, and God's guidance. I know that sometimes we may experience some trials and troubles in our life, but let's fight. Let's continue to pray. Let's continue to live. Let's continue to do what is right. I know some of you are having difficulties in your studies, but kaya yan! 2 more weeks. Okay, will be your midterm exam na. So mag-aral po tayo. At the same time, you pray. Okay? Continue to pray. Continue to ask for God's guidance, light, mercy, and blessings. Alright, so this week, we will continue with our topic on physical examination. Particularly, in this presentation, we will discuss about the physical examination of the eyes. Alright, let's proceed. Alright, before proceeding, of course, let me present this slide to you first. Okay. Okay. So right after doing the physical examination of the head and the neck, the next in line is to do the physical examination of the eyes. So the eye, so what is the function of your eyes? Okay, so why do we need to do the physical examination of the eye? Alright, so the eye is the sensory organ of vision, and it has many critical components, including the cranial nerves. So your role as a nurse or as a student nurse is to detect those changes of the eye or of the vision of your patient. And of course, to note those changes and report it to your clinical instructor, or you have to work it with a healthcare team member such as the physicians or the ophthalmologist of your patient. Of course, this is to prevent injury and, of course, prevent loss of vision. Okay, so let us proceed. Okay, so these are the learning objectives of this presentation. At the end of this presentation, the student will be able to identify components and function of the eye, collect accurate history of the eye, demonstrate how to perform physical assessment of the eye, identify measures for prevention or early detection of eye disease, infections, or vision loss. Document complete eye assessment. Okay. All right. So before we proceed to our physical examination of the eyes, let us first recall your anatomy and physiology. Okay, so again, your eye is a sensory organ that is responsible for vision. Okay, it is a spherical structure that focuses light on the retina, and then your retina will send signal through the optic nerves into the back of your brain, and then the brain will interpret it as an image. Okay, so the muscles of the iris control the pupillary responses, whether your pupil will constrict, so depende sa light, no, that will pass through your pupil. So if there is light, your pupil will constrict, meaning liliit siya. And then, if you are in the dark room, your pupil will dilate. So, lalaki siya. Okay. So, again, your eye enables your vision. So, there are nerves that are responsible, okay, of the function of your eyes. Okay, we have the cranial nerve number 2, or your optic nerve. So this is responsible for visual acuity. So mamaya, i-check natin paano mag-check ng visual acuity for near vision and far vision. Okay, and then the other one is the cranial nerve number 3, the oculomotor. So this is responsible for opening of the eyelids. Okay, the eye movement. Magmo-move yung eye mo upward, medial, upward, lateral, upward, downward. Okay? So, yan yung function ng iyong oculomotor nerve. And then, your cranial nerve number 4, which is your trochlear nerve. Okay? It is again responsible for eye movement, particularly for downward medial. And then, the cranial nerve number 6, which is your abducens, okay? It is responsible for eye movement laterally, okay? So, again, your cranial nerve number 4 and your cranial nerve number 6 is considered as your extraocular movement, no? Okay, so this is the structure of the eyes. Okay, you have the upper eyelid, the lower eyelid. So the upper eyelid, it covers the portion of the iris, but it does not touch the pupil. Okay, the sclera, it is covered by your conjunctiva. You have two types of conjunctiva, the palpebral and the bulbar conjunctiva. Okay, so your sclera is white in color. So, dito natin makikita if the patient has problem with the liver kasi nagkakaroon ng changes ang color ng yung sclera. The lateral canthus, the medial canthus, and then you have the iris, no? Yung iris is, ito yung may kulay sa ating eyes. It gives color to your eyes, no? And it is responsible for constricting and dilating of the pupil kasi may muscle dyan sa sides, okay? And then you have the limbus. Ito yung parang ring around the iris, okay? So, yung iris of the Filipino is usually brown, di ba? Yung mga Asian, Hispanics, yan. Okay, so moving on to this image. This is a sagittal section of an anterior eye with eyelids closed, and these are the structures. We have the tarsal plate. It is a form of connective tissue that lies within the eyelid. Okay, and we have the levator palpebrae. It is a muscle that is responsible for raising the upper eyelid, and it is innervated by sympathetic nervous system, and it also contributes to the lid elevation. Okay, and we have the meibomian glands or the oil gland, which is also responsible for lubricating the eyes. And we have the cornea. Okay, it is a clear, a protective outer layer that serves as a barrier against dirt, germs, and other foreign bodies. It also filters ultraviolet light. So, in other words, it protects your eyes. So, ito yung nandyan sa labas ng iyong eyes. Diba? Pag open mo, ito yung nilalagyan natin ng contact lens. Ayan. So, you have to take care in applying your contact lens. Kasi pag na-damage yan, corneal transplant. Okay. And then, you have the eyelashes. Okay. So, this is considered as the first line of defense for your eyes. Ayan, para nag-protect yan sa eye mo. So, understanding the anatomy and physiology of our human body is really amazing, di ba? Parang napakagaling talaga ng ating creator. Ang galing talaga ng pagkaka-create niya. It's not just because of DNA, blah, blah, blah. So, of course, pinag-aralan at matalino ang ating creator because everything has a purpose in our body and even in this world. Alright. So, you have the sclera, and then the vulvar conjunctiva, and the palpebral conjunctiva. So, dito natin makikita kapag pale ba yung conjunctiva, kapag dry, dapat moist yan, kasi dyan natin makikita ang signs of dehydrations or signs of infections. Yan. Okay. Now, moving on, the lacrimal system. So, merong lacrimal system ang ating eyes. Okay. There is a film of clear fluid that protects the conjunctiva and the cornea from drying. Kasi di ba nag-open close yan. So, kung walang lubricants dyan, imaginein mo na lang, di ba? Pag nagko-close, pwedeng malacerate ang iyong cornea or ang iyong sclera. It inhibits a microbial growth and it gives smooth optical surface to the cornea. So these fluids came from the lacrimal glands or your lacrimal system. So the lacrimal gland, okay, this is the lacrimal gland. No, tandaan kung nasaan yan kasi during your physical examination sa RLE, you really have to touch dyan. Hahawakan mo yan, no? Within the bony orbit above and lateral to the eyeball. So, it is located here. You have to press it, no? Titingnan natin kung may tenderness, may swelling ba yan. Okay? And you have the lacrimal puncta. It is actually a two holes where the tear fluid drains. Diyan nagdi-drain yung fluid, no, ng tears pag naiyak ka. Okay, pag na-irritate ang iyong eyes or kapag emotionally sad ka, di ba? Okay, so that the tears will flow here to the puncta, will drain here, and then to the lacrimal sac down to your nasolacrimal duct. Di ba nalalasahan mo yun pag umiiyak ka? Yan. Okay. Okay, so this is the eyeball, no? Ito yung itsura ng eyeball. So, sagittal section ulit ito of the eyeball. So, eyeball is a spherical structure that focuses light on the neurosensory elements within the retina. So, meron tayong ciliary body, no? The ciliary body is composed of muscles that control the thickness of the lens, okay? Allowing the eye to focus on the near and distant objects. So, siya yung responsible. Okay? And you have two fluids. No, may dalawang fluids ang ating eyes. Yan. Diba? Yung vitreous humor and the aqueous humor. So, the vitreous humor is the clear gel. So, parang siyang gel that fills the space between the lens and the retina. So, nandyan siya between the lens and the retina. So, parang gel siya. So, siya yung nag-give ng form sa iyong eyeball. And you have the aqueous humor. It is the clear liquid that fills the anterior and posterior chamber of the eye. So, it is circulating between the lens and the cornea. So, yan. So, paano ba siya? So, your aqueous humor is produced by the ciliary body, no? And it circulates from the posterior chamber through the pupil, okay, into the anterior chamber, and it drains through the canal of sclem, okay? So, this circulatory system, it helps to control the pressure inside the eye. So, para maiwasan yung increasing of the eye pressure, no, that causes glaucoma or eye problem. And glaucoma is delikado siya because it might cause vision loss to the client kapag hindi siya naagapan. Alright? So, this is a cross-section of the eye that can be seen through the ophthalmoscope. Okay, so you will be using your ophthalmoscope to view, okay, the structure inside the eye, okay, especially the retina, the choroid, where is the choroid, the fovea, the macula, okay, this is the macula, the optic disc, okay, this is the optic disc, no, kaside sa macula, and the retinal vessels. You have the vein and the arteries around the retina. So, the optic nerve with its retinal vessels, it enters into the eyeball posteriorly. Okay, yan. Diyan pumapasok. Alright? So, this can only be seen using your ophthalmoscope. Okay, so this image shows the visual fields. So the visual fields is the entire area seen by an eye when it looks at the central point. Okay, so the center of the circle, okay, this one, represents the focus of gaze. So this picture shows this one is the right eye and this one is the left eye. So the visual fields are normally limited by the bones, okay, or by the brows above and the cheekbones, okay, sa dito sa side, and the nose medially, okay, but mas mahaba yung upper temporal and the lower temporal na nakikita natin. So, in the next slides, this will be discussed further of how to test the visual fields of your client. Okay, so a lack of retinal receptors of the optic disc can produce an oval blind spot in the normal field of each eye. Okay. So this image shows a two overlap visual fields. Okay. When a person is using both eyes, the two visual fields overlap. Ayan, pag nakatingin ka, dalawa. So, nag-overlap yung visual fields mo. Okay? This is called binocular vision. But laterally, when you're looking at the lateral sides, it is, you're only using one eye. Okay? Right eye or left eye. So, this is called monocular vision. Okay, let's now discuss the visual pathways. Okay, so the human eye has a feature like a camera. So we have the lens, which focuses the light, and the cornea, which bend the light rays. And its primary focus or function is to form the image onto the retina. Okay, which is your receptive surface inside the eyes. Okay, so the visual image is inverted from top to bottom and reverse right to left eye. Okay, again, to see an image, the light reflected from the image must pass through the pupil and be focused in the photoreceptors, and then the image projected there are again upside down, no, and reverse right to left eye. Okay. So, an image from the upper nasal visual field thus strikes the lower temporal quadrant of the retina. Okay. The nerve impulses stimulated by light are conducted through the retina, the optic nerve number 2, and the optic tract on each side. Ayan. Then, through the curving tract called the optic radiation, and then this ends to the visual cortex, which is part of your occipital lobe, the back of your brain. Alright, to understand better the visual pathways, I have here the link wherein you can watch the visual pathways for more information. Okay, moving on to the pathways of light reaction. So the light or the light beam shining onto the retina causes the pupillary reaction or constriction of the pupil on both eyes. Lumiliit, no? Kahit dito ka lang sa left, nagsushine ng light, napapansin mo, nagko-constricto, hindi lang yan, nagko-constrict din yung right eye. Okay, so it is called as direct reaction to light. On the other hand, in the contralateral or opposite eye, this is called the consensual reaction to light. Okay, the initial sensory pathways are similar to those described for vision. So dumadaan siya, yung light to retina, then to the optic nerve, cranial nerve number 2, then to the optic tract, which diverges to the midbrain, kung saan i-interpret yung image na yon. And then the impulses back to the constrictor muscle are transmitted via the oculomotor nerve or the cranial nerve number 3 to the constrictor muscle again of the iris of each eye that are transmitted through the oculomotor nerve. Alright. Okay, so this is the sample reaction of the pupil when looking at the near object. Okay. This occurs when the person shifts gaze from a far object to a near object. So, paano ba yung gagawin mo? You ask the client to look at, halimbawa, ito yung ball pen. So, tingin lang po, and then you move. Diyan lang po nakatingin, no? And then you move the object, okay, papalapit doon sa eye of the client. And then, you will observe that the pupil constrict. Yun ang normal reaction, no, ng iyong pupil. Kapag you are looking at the near object, from far object, it will constrict. While you are looking at the far object, usually the pupil dilate. Okay. So this response is just like the light reaction discussed in the previous slide. It is mediated by the oculomotor nerve or your cranial nerve number 3. Okay. This pupillary reactions is called as convergence. Okay. Convergence of the eyes. If it is from medial rectus movement and accommodation. Okay. So, convergence and accommodation, makikita nyo yan sa inyong checklist. Yan yung reaction of the pupil when you are looking at the near object wherein your pupil nagko-constrict na. Okay. Accommodation is a result by an increased convexity of the lenses that is caused by the contraction of the ciliary muscle of your eyes. Okay, so this is just another image of the visual pathways from retina to the visual cortex, no? Kung ano yung nangyayari. Kasi kanina, nag-stop lang tayo hanggang dito sa retina. So, may mga optic nerve ka dyan. Okay, the visual cortex is actually the primary cortical region of the brain that receives, integrates, and processes the visual information relayed from the retina. Okay, ito yung left eye and the right eye. It is in the occipital lobe of the primary cerebral cortex of your brain, which is the most posterior region of the brain. Okay, so dyan siya pinaprocess. Alright? Okay. Slide shows how to check the extraocular movement of the eye. So when we say extraocular movement, we are checking for the muscle movement of the eye. Kung kaya niya bang tingnan or wala bang problem sa muscle of the eye. Okay, kung coordinated ba yung action of the 6 muscles of the eyes. The 6 muscles are the following. Meron tayong 4 rectus muscle of the eye, the superior rectus, the inferior rectus, and the lateral rectus and the medial rectus. Okay. And we have 2 oblique. Okay, oblique muscle, the inferior oblique, okay, and then the superior oblique. Okay. So, cranial nerve number 3 is responsible when ito yung nagmo-move, no, yung oculomotor nerve or cranial nerve number 3, siya yung responsible or kapag may problem, ang tao tumingin sa baba and to the right, so the problem is on cranial nerve number 3. Okay. Okay, the cranial nerve number 4 naman or your trochlear, this is responsible, okay, your left superior oblique, okay, left superior oblique, okay, this is responsible for moving the left eye. Yan. So, paano ba yan mamaya, no? Pwede mong i-instruct si client to sundan yan. Okay, and then sa gitna ulit, sa taas. Susundan mo lang yung 6. Okay, 6 direction na yon. Susundan ni patient if the muscle is can move in coordination. Okay. Okay, so now let's move on to the common and concerning symptoms that you must take note when you are doing the physical examination and you observe or you found out the following. Okay, changes in vision. Okay, merong hyperopia. Hyperopia refers to farsightedness wherein you can see distant object clearly. This can be due to eye bending light property or hereditary. And we have another one, abnormality, no, of the vision, presbyopia. It refers to the gradual loss of your eye's ability to see or to focus on nearby object. It is natural daw. It's a part of aging. Okay, this can be noticeable when a person aged from mid-40s. Oh no. Okay, unti-unting nawawala yung paningin mo sa mga near object. And then another one is myopia, or it refers to nearsightedness, which is a common condition in which you can see objects near to you clearly. Okay, it occurs when the shape of your eye causes light rays to bend or refract incorrectly. And then we have another changes of vision, the scotoma, no? It is an area of lost or depressed vision within the visual field, okay? And it is surrounded by the area of normal vision. So, may part na parang may blind spot ka dun sa area na yon. And we have another, diplopia. Diplopia is when you see 2 images of the thing, double vision. Diba? So, you might know you have diplopia in your eye or in your both eyes. And another one is strabismus or crossed eye. Okay, sometimes ito nako-cross yung kabila kong eye kasi lazy eye yung aking left, no? It is a condition in which the eyes do not line up with one another. In other words, one eye is turned in a direction that is different from the other eye. So just like my left eye, when I look at the left, hindi siya nagmo-move, lazy eye siya. So nandyan lang siya, naka-steady lang siya. Pag titingin ako sa right eye, ayun, nakakatingin sa right eye. So, kaya pag titingin ako sa left eye, I have to move my head. Yan. Hindi pwedeng eyes lang. Okay? So, blurring. Okay, maybe may opacity of the lens, blurry of vision, or nawala yung linaw, no? Redness of the eye, itching, discharge, pain. Naku, baka may glaucoma na, no? Kasi pain, may increased pressure, increased intraocular pressure. Tearing, baka nagkaroon ng tearing kahit hindi naman siya umiiyak talaga or hindi naman siya, wala naman siyang emotional problem, pero nagluluha siya. This could be a sign of blockage in your nasal cavity. Baka may na-block dyan. Edema, lesions, visual disturbances, and photophobia. Photophobia or light sensitivity is usually from the excess of light entering the eye, which may overexcite the photoreceptors in the retina. Parang ayaw mong tumingin, photophobia. So same with the physical assessment in other parts of the body, you always start with a health history wherein you have to ask the client the following question. Do you have difficulties with close work or at distance? Okay, so you have to check kung may hyperopia ba si client, presbyopia, or myopia. So, of course, do not use this term. You have to state it in a layman's term wherein the patient can understand. So, wala bang hirap sa pagtingin sa malayong object? Okay, hindi ba unti-unti nawawala ang focus on the near object? Okay, nearsighted ba? Yan. Are you experiencing a blurring of vision? Okay, sa buo ba talaga in your one eye? Or meron lang part, okay, sa right, sa left, okay? Is it in both eyes or just one eye? Okay, so to continue with your health history taking, you have to assess or to ask your client if it is painful or painless. So if you observe or if the patient reported it is sudden, it is unilateral, and it is painless, that could be a sign of vitreous hemorrhage or macular degeneration, or could be retinal detachment or retinal vein occlusion or central retinal artery occlusion. If it is painful and unilateral, you could suspect a corneal ulcer, uveitis, okay, traumatic hyphema, or acute glaucoma, or optic neuritis. Right. Yan. So, is it painless or painful? If it is bilateral and it is painless, that could be just a result of medications such as cholinergics, anticholinergics, or steroids. If it is bilateral or both eyes and painful, that could be the effect of chemical or radiation exposure. Yan, kaya masakit yung eyes. If it is bilateral and gradual yung onset ng pain, that could be a sign of cataracts or macular degeneration. So, macula sa loob yun ng eye, the central vision. Your macula is responsible for the central vision. Okay, is there flashing lights? Nako, pag may flashing lights, you would suspect a detachment of vitreous from retina. Bakit nagkaroon ng detachment of vitreous from retina? Could be from pressure, okay? Yung hypertensive or yung may diabetes. Ito yung common complication, no, sa retina. May floaters ba na nakikita? So that could be a vitreous floaters. Specs, okay? It could be a fixed defects or lesion in the retina or visual pathways. Kanina. Okay. So, is there double vision? Kapag meron, probably there is a lesion in the brainstem or paralysis of extraocular muscle or in the cornea or lens defect. Is there redness? That could be due to allergies or infection. Is there uncomfortable in sun or well-lit places? Okay, that could be a sign of photophobia. Now, let's check the past history of the eye problems or disease. Okay. May history ba of premature birth ba? Tama ba yung edad ng pinanganak? Or may history ba of trauma? Surgery? Nagka-history ba ng infections of the eyes or any kinds of disease? Okay, structural deformities, particularly of the eyes. So you may want to ask the client for his or her last eye examination for you to have a baseline. Okay? You can do color blindness test. Meron itong cards wherein ipapabasa mo sa patient kung ano yung nakikita niya. Okay? Or you can ask the client if the client wear glasses or contacts. Okay? Is it hard or soft lenses? And then you can ask the client, when did you first start wearing them? Is it for corrective or cosmetic purposes only? How did you care for them? Okay, ano ba yung how did you care for them? If, for example, contact lens yan, paano mo nililinis? Do you share contact lenses na prone to infection? If you share, dapat para lang sa'yo yan. Remember, that's a may mucous membrane dyan. How long are the contacts in your eyes? Baka 3 days na walang tanggal-tanggal? Okay. Right. Okay, and then you have to check the family history of the client for the following. Congenital eye diseases that could be due to drug exposure or alcohol. Yan. Cataracts, congenital cataracts, meron ganon. Cataract refers to opacity of the lens. No? This is common for the seniors, the mga elderly natin, wherein nagkaroon na ng opacity of the lens due to aging. But again, there are congenital cataract as well. Okay, glaucoma. Okay, glaucoma is there is an increased intraocular pressure that cause damage of the optic nerve, no? And then, is there a history or family history of macular degeneration? Okay. It refers to the eye disease that affect the macula or the center of the light-sensitive retina at the back of your eyes. And is there history of diabetes, particularly diabetes retinopathy, which is a disorder that caused by damage of blood vessels of the light-sensitive tissue at the back of your eye, which is your retina. Yung example natin kanina, yung retinal detachment. Okay. And you also check the lifestyle of your client, okay, or the lifestyle habits, the personal or social history of your client. Do you smoke? Do you wear sunglasses when you are outside? Okay. Do you use protective eyewear? Are you using any medications or drugs that dry out the eyes? Okay. And then let's proceed to the physical examination. So now, let's prepare the patient. Okay. So, how will you prepare your patient? Of course, it depends to the location of your Snellen chart, whether it is located inside your clinic or outside the room. Okay. Make sure that you have a well-lit area and of course, free of distractions. Hindi magulo, walang lakad ng lakad dyan. Okay? And also prepare the following equipment for your examination. You need your Snellen chart or your e-card. Okay? So your Snellen chart, this is used to check for far vision of your client. Okay, e-card is used to check for a patient with difficulty in reading or those patients who cannot read words or for the children. Yan. Rosenbaum or near vision card. Okay, yung parang ano rin siya, para rin siyang Snellen chart but maliit lang siya na version. Okay. Kung sa Snellen chart, 20/20, sa Rosenbaum or the near vision card, it is just 14/14 yung vision. The index card or opaque card, that is to use to cover one eye if you're checking one eye at a time. And then, of course, the pen light. Okay. And ophthalmoscope to view the internal structure of the eyes. Okay, to check for the visual acuity. Okay, this is our vision test number 1. So the distal, or to test for the vision, distal vision, okay, you have to use the Snellen chart or the E chart. And then you ask the client to cover one eye with index card and then read the smallest line. Ano yun? Hanggang saan yung kaya niyang basahin? Of course, you have to let the client sit down at least 20 feet away from the Snellen chart. Repeat with one other eye. Okay. Note if testing is completed with corrective lenses. So, pwedeng walang lenses muna para ma-compare mo, and then pwedeng may corrective lenses na siya kung ano yung currently used ni patient. Findings recorded as fraction. Okay. Numerator is the distance patient is from the chart, and the denominator is the distance that the normal eye can read the chart. Okay. So, this is an example of your Snellen chart. Okay. And then, of course, you ask the client to cover one eye with an opaque card. And then you have to let the client sit down or stand up at a distance of 20 feet away from the Snellen chart. And then again, you ask the client to read kung ano yung pinakamabasa niya dyan sa smallest letter. And then may equivalent numbers dyan na may equivalent reading din. Okay? Alright, moving on to our vision acuity test. For the near vision, again, you have to use the Rosenbaum chart. And then you ask the client to hold the card at least 14 inches from the patient. Okay, 14 inches. And then you help the client identify the need for bifocal or reading glasses. Ayan, yan yung purpose natin. Especially if your patient is at the age of 40 na, okay, wherein the near vision begins to decrease, okay, or also known as the Jigger card, okay, Rosenbaum or Jigger card, okay. Now, after doing the physical examination on visual acuity, we have to proceed to the assessment of the peripheral visual fields by confrontation. It is actually a comparison between the patient and the nurse, provided that the nurse has intact peripheral vision to determine any areas of deficit. Okay, how to do this? Of course, you have to stand at least 2 feet away from your client. And then you have to ask your client to look at with both eyes into your eyes, okay, and then you have to spread your arms apart just behind and lateral to the patient's head, so side lang ha, and then instruct the patient to point to your wiggling fingers as soon as they are seen. So saan po nakita? Sa taas, sa baba, okay, you have to come from both sides, and then you have to slowly move the wiggling fingers of both of your hands along the imaginary ball, okay, toward the center until the patient points to them. You have to repeat this pattern in the upper and the lower temporal quadrant. Usually, a person sees both sets of fingers at the same time. So, if so, the visual fields are normal. After doing the peripheral test, okay, These are the field defects that are all or partly temporal. We have the homonymous hemianopsia, wherein it refers to a visual field defect that involves either two halves or two right or two left halves of the visual field of the both eyes. Ayan, parehong right. Bitemporal hemianopsia, it refers to a partial blindness where vision field is or having a problem, okay, on the outer half, yan, outer half of both left and right eye, okay? So this is associated with the lesions of the optic chiasm. And then another one or another disorder is a quadratic defects or known as quadratanopia. Okay, it refers to the anopia that is affecting a quarter of the field vision. So yan, quarter of the field vision. Right. If defect is suspected, you have to establish boundaries and you have to test one eye at a time. So, ganun din, kung ang pinapakover mo sa patient is the left eye, you have to cover your left eye as well. And then you do the same, you stand 2 feet away from the client and then you ask the client to see or to point kung saan niya nakita yung nagwi-wiggle mong finger no nasa lateral sides of the client, upper, okay, lateral, or at the middle and lower. So yan. Okay. So another visual field defects, okay, meron tayong what we call the horizontal defect. So as you can see, yung defect is horizontally, ito yung side na merong visual field problem. Another one is the blind right. Ito talaga yung walang nakita, nubuo talaga, blind right. Okay, these are another visual field defects. Now we have the bitemporal hemianopsia. Okay, so alam naman natin that hemianopsia refers to blindness of one half of the visual field that is generally on one side. Now, this can occur after a cerebrovascular accident. Okay? So, a temporal defect in visual field of one eye suggests also a nasal defect in the other eye, kung isa lang siya. Okay, we have left homonymous hemianopsia. So, merong problem, no? Napakita na natin din to in the previous slides. So, parehong side, no? Nasa left, parehong nasa left, yung blindness. Okay, another picture or another presentation of homonymous left superior quadrantic defect. Okay, so parehong sa left. Left homonymous hemianopsia, so half talaga na pareho sa left. Okay. The small visual field defects and enlarged blind spots require a finer stimulus like red object, no, kapag small lang siya. Yung enlarged blind spots daw can occur in conditions affecting the optic nerve such as the glaucoma, optic neuritis, and papillary edema. Yan. So this image shows the lesions or the location of the lesions in a particular structure of the eyes that causes the visual field defect. So here you have the black color here, which is just behind your retina, okay? So kapag nandito yung lesions, there will be horizontal defect of the eye or blindness, okay? And then if the lesion is located here at the right optic nerve, okay, there will be a blind right eye. Okay, so nagiging blind yung right eye. And then, if the lesions is located here at the optic chiasm, there will be bitemporal hemianopsia. Okay, half lang. Okay, and then if the lesion is here at the right, okay, the optic tract of the right eye, there will be left homonymous hemianopsia. All right, and if the lesion is located here at the optic radiator of the right eye, there will be homonymous left superior quadrantic defect. So, hindi buo, kaya portion lang siya, no? Parang 1/4. Okay. And if the lesion is located here at the malapit na sa visual cortex, no? Okay, there will be left homonymous hemianopsia. Kasi black talaga siya dyan. Yung lesions niya talagang na-cover yan. So, just like your number 4. Okay. So, in proceeding with the physical examination, you have to make sure to check the position and the alignment of the eyes. Okay, you have to check if there is abnormal protrusion or nakaluwa yung eyes. That could be a sign of Graves' disease for those who have hyperthyroidism, or it could be a sign of an ocular tumor kasi bakit nakaprotrude yung kanyang eyes. And then you have also to check the position of the eyebrows. Is it symmetrical ba yung eyebrows? Okay. Check for scaliness. Could be a sign of seborrheic dermatitis. And then check for lateral sparseness. Okay, kumukunti ang kilay laterally. Titingnan natin yung mga kilay natin. That could be a sign of hypothyroidism. So, conscious tuloy ako kasi may problem ako with the thyroid. So, binabantayan ko yung aking eyebrows. Okay. Okay, then continue with your physical examination on the eyelids. Check for the upper and the lower eyelids for the width of the palpebral fissures. Okay, for example, there is a upstarting palpebral fissures that could be a sign of or commonly seen in the patient with Down syndrome. Okay. Also note for edema of the eyelids, that could be a sign of Cushing syndrome or those patients who have kidney problems. Note for the color of the eyelids, okay, the lesions, and the condition and direction of the eyelids, okay. Adequacy with eyelids closed. So normally daw, a normal person blinks at least 12 to 15 blinks in a minute. Okay, so it depends to your reference, no? Okay, so moving on to the variations and abnormalities of the eyelids. Okay, so here we have the ptosis, or the drooping or falling of the upper eyelid, or seen in a patient with lazy eye, no? Or amblyopia. Yan. So, parang katulad sa akin, maliit yung isang eyes. Okay? And then, lid retraction and exophthalmos, no? Common with the patient with hyperthyroidism. Okay. So, another findings of the eyelids, we have what we call the entropion, wherein the eyelid, usually the lower one is turned inward. Okay, entropion, from the word entropion, inward. Ectropion naman, the eyelids is turned outward. Yan. So, this is the presentation. Alright. So now let's proceed to the assessment of the lacrimal apparatus. Okay, so again, you have to check where is your lacrimal gland. Kasi ipipress mo yung lacrimal gland, ipipress mo yung lacrimal sac, okay, dito banda. Okay, so to check if there is swelling, okay, or there is excessive tearing, umiiyak or tumutuloy yung luha, that could be a sign of blockage, no? Or there could be a conjunctival inflammation or corneal irritation that causes the excessive tearing of the lacrimal apparatus. Check also for dryness and crusting of the eyes, okay? Could be a sign of ectropion, yung nakita nyo in the previous slides, okay? Yung eyelids, lower eyelid, naka-point outward. And the nasolacrimal duct obstruction. Yan, kaya nagkaroon ng dryness, hindi makakadaan yung tears. Okay. Okay, so these are another abnormality or abnormal findings of the eyes. We have the lumps and swelling in and around the eyes. We have what we call the pinguicula, okay, wherein this is a harmless yellowish triangular nodule in the bulbar conjunctiva. Yan, dyan. Or in the side of the iris. Yan. So, it appears frequently with aging. So, habang tumatanda, merong lumalabas na ganyan. So, first on the nasal and then nasal side and then on the temporal side of the eyes. And then we have here epescleritis, or it is a localized ocular redness from the inflammation of the epescleral vessels or the blood vessels. There is redness and dilated blood vessels. Okay, so another abnormality of the eyes, or lumps and swelling around or inside your eyes. So we have hordeolum. Okay, it is a painful, tender, red infection in the gland or at the margin of the eyelid. And we have another here, the chalazion. It is a subacute and usually painless nodule involving a meibomian gland, your oil gland. Okay, so it is unlike the stye or the hordeolum that is usually points inside the lid. Nasa loob siya, di ba? Yung hordeolum is, ayan, o nasa labas siya. So, yan, inside the lid. Okay. Okay, another abnormality or lumps and swelling in the or around the eyes. We have the xanthelasma. It is a slightly, here, no, this is one, slightly raised, yellowish, well-circumscribed plaques, diba, that appear along the nasal portion of one or both eyelids here. So, another one is the dacryocystitis. There is an inflammation of the lacrimal sac here, or the lacrimal duct. Okay, there is a painful, red, and tender chronic swelling or obstruction of the nasolacrimal duct. Okay. So moving on to the assessment of the conjunctiva and the sclera. So you have to check the palpebral and the bulbar conjunctiva. And this is the sclera. Okay, the normal color of the sclera is a white, diba? But for the dark-skinned client, pag may itim talaga sila, normal na sa kanila yung yellowish yung kanilang sclera. Right. Okay, so in checking the conjunctiva, pwede kang gumamit ng cotton buds. Okay, pwede nating i-invert yan para ma-check mo, or you can do this one. Okay, you can hold it with your index finger and your thumb. Okay, and then you ask the client to look straight lang. Okay, and this is the sclera, no, merong epescleritis. Okay. So, the abnormal findings of the eye, again, no, we have the conjunctivitis or abnormal findings of the conjunctiva. So, it is also called as the pink eye, or it is an inflammation or infection of the transparent membranes that lines your eyelids. Yan, yung transparent membrane dyan. Okay. Between your eyelids and your eyeball. So, kaya napansin mo, pati yung nakikita na rin sa sclera, yung redness, no? It is characterized by redness and gritty sensation in your eyes, along with itching. So, di ba, na-experience nyo na yan. And we have another abnormality or abnormal findings of the conjunctiva. We have the subconjunctival hemorrhage. Okay. So, it occurs when a tiny blood vessel breaks, okay, just underneath the clear surface of the eye or under your conjunctiva. Okay. So, trauma yan. Kaya nagkaroon ng conjunctival hemorrhage. So, nawawala rin naman yan. Okay. And let's proceed to the cornea and the lens. Okay, let's check the cornea and the lens. Okay, so ito yung abnormal findings din, no? Or actually, this is not significant findings naman, pero this is not normal. Okay, so we have the corneal arsus, or known as the arsus senilis. This is for seniors, okay, or arsus juvenile for those under 40 years old. So, common siya nakikita sa mga seniors. So, part of aging. So, nagkaroon ng arsus senilis or corneal arsus. Eh, ano, nagiging whitish yung side sa cornea. So, parang nagkaroon ng ring. Okay? So, it is typically age-related condition that creates a deposit of cholesterol. Cholesterol pala yan. Phospholipids and triglycerides. Okay, in a form of an arc. It could be either on the top or at the bottom of the side of the iris. Okay, just inside the cornea. Another findings of the eyes or in the cornea, we have the corneal scar here. Now you can see it. No, it is either opacity or irregularity in the cornea that can limit the corneal's ability to accurately focus the light. Yan. So, pag covered talaga lahat, so it might cause blindness. So that's why nagkakaroon ng corneal transplant. So, iwasan natin lalo na those who are wearing tawag dito, contact lenses na hindi maayos yung paggamit or sobrang nag-dry or nakatulog na meron pa yung contact lens or any damage or trauma to the cornea. So, might lead to corneal scar. So, here on the right side, we have the pterygium. Okay, is an elevated superficial external ocular mass that usually forms over the perilimbical conjunctiva. So, mula siya dito, no, sa conjunctiva, and it extends onto the corneal surface. So, kinakain na yan. The causes of this is too much exposure to light. Okay, yun yung kanyang common causes, okay, can lead to growth of this pterygium kapag too much exposure to light ka without sun protector. Okay, it occurs more often in the people who live in the warm climates and spend a lot of time outdoors. Ating mga farmers, yan, yung palaging nasa labas in a sunny or windy environment kasi yung mga dust din. Yan, that causes the pterygium. So, ini-scrape din yan, no? Ginagawa rin yan ng mga ophthalmologists. And here is another example of corneal injury or infection. Of course, nagkaroon ng redness around din. So, magkaroon ng corneal injury or infection, it may lead again to corneal scar. Okay. Okay, so moving on to another abnormal findings of the eyes, particularly on the lens, no? We have the nuclear cataract. Okay, so look at the difference between the nuclear cataract and the peripheral cataract. Okay, so the nuclear cataracts are clouding, no, and hardening of the lens, particularly at the center of the lens, that results to blurring of vision. Diba? Parang may clouds ang dinedescribe ng pasyente, glare, and other changes in the vision. So, they are the most common type of cataract that occurs to our patient more than 60 years old, okay, or 75 years old older. So, mas hinog na pag 75 years old older. So, meron na talaga silang cataract because this is part of aging. So, konti lang talaga yung wala talagang cataract, no? And then, it's part of wearing and tearing of the lens, diba, of the client. Okay, so another type of cataract here is the peripheral cataract. Okay, so wherein the cloudiness of the lens usually located at the or near the outer edges of the lens. Okay, nandyan sa outer edges of the lens yung cloudiness. Okay, the common symptoms is glare from light sources. Okay, such as yung mga headlights, nakakasilaw or hindi nakikita. So, merong peripheral cataract from the word periphery. So, nasa sides. Okay, and then, okay, let's check the iris. Okay. So, di ba ano nga ba yung iris? So, ito yung iris, no, that gives color to the eye. So, it depends kung ano yung lahi mo. Okay. So, you have to note for the markings, okay, that should be the clearly defined, no? It should have no shadow like this one. So, dapat walang shadow yan. This narrow angle, yung nakikita nyo, increase the risk for acute narrow angle glaucoma. So, na-observe yan, no? Wherein there is, sa acute angle glaucoma, there is a sudden increase in the intraocular pressure, okay? When the drainage of the aqueous humor is blocked. So, may blockage doon. Yan. So, nagkaroon ng pressure, kaya mayroon tayong acute narrow angle glaucoma. So, may shadow. So, dapat walang shadow yung iris. The normal color of the iris is, of course, brown for the Filipino or for the Asians, diba? For Americans, so, some of the American are also brown yung kanilang iris. Okay. Okay, so this image shows another example of red eyes. We have a condition called acute iritis or merong redness, no, around the iris. Okay, this is due to a blunt force trauma or a penetrating injury or a burn from a chemical or fire that can cause this specific condition. Okay, pwede rin infections or viral infections of the face. Okay, and we have another condition here, the glaucoma or the acute glaucoma or acute angle closure glaucoma. Okay, wherein there is an obstruction doon sa flow ng ating aqueous humor that causes the increased intraocular pressure. Okay, so may pain din si patient, tapos yan, may manifestation of redness of the eyes. Alright, so this ends the first part of our physical examination on the eyes. Okay, please watch the second video or the second part of this video. Okay, thank you very much, and let me end this presentation by reading this Bible verse, 2 Chronicles 15:2-7. Be ye strong, therefore, and let not your hands be weak, for your work shall be rewarded. So, work lang tayo, study hard, okay, gawin lang natin yung best natin. And later on, we will be rewarded. Okay, God bless everyone! the references of my presentation. Thank you very much.